Hospital.
Come again?
I am Dr. Moyaf Daniel, the Acting Hospital Director, Mbale Regional Referral Hospital. I am here today breaking ground for construction of a new theatre in maternity related to maternal child health services in Mbale Regional Referral Hospital. Apparently, for years, we have been having only one theatre, and on an average, we have been doing about 10 scissors in a day. And this has caused waiting of these mothers who are having emergencies, because one room is being used by all the doctors. So in the long run, the outcomes are not as good, but apparently with the support from Ministry of Health, we have managed to get a new theatre, which we've broken ground for, that is going to improve or reduce on the waiting time for these mothers who come who are in need of a service, and that is for scissors in the regional referral hospital. And this in future will reduce on the neonatal deaths, babies with obstructed labor, and also reduce on the deaths of these mothers who come needing emergency scissors when they come to the regional referral hospital. And as a regional referral hospital, we have built capacity of consultants. We have master's students, so they're called the SHOs, senior house officers, and we have the junior house officers and the interns. So this construction of the theatre is timely because all these people use the same theatre. And that is the reason why I would like to thank the Ministry of Health and SID Global and the administration of the Regional Referral Hospital for giving us a way to start on this project, and that will improve our services in the region as Elgon and across the borders of Mbale as a city. So thank you so much for the support, and we continue to pledge for more support, that we can continue to have even as more theatres. If we can have like 3 or 5 theatres, that will have in future, because our population is at least at about 45 to 50 million. And as Mbale Regional Referral Hospital, we are serving 17 districts with 1 city. And this gives us a leverage of populations of huge numbers of patients. And yet this is only a 500 bed capacity hospital. But the population you're serving is more bigger than what you can do, which was done then. So more theatres would be the best. 5 or 3 theatres would be a better deal for us as we plan for the future of the hospital. Thank you very much. Those are usually human resource, the doctors, the nurses, most of the midwives are very few, and that is a big challenge for us. So recruitment is ongoing. We can have the recruitment plan to take on more midwives that can help improve on the service deliveries in the hospital. So that's one of the biggest challenges as well now, human resource. Referrals, apparently, as a regional referral hospital, under the guidance of the PS and the Ministry of Health, we have established in place a system called LMNS, a local maternity network system. And this is about referring mothers. If you are to refer a mother from Butaleja and the only issue you need is blood, we deliver blood to you so that you can handle the emergency at that scene. If you are referring a mother from Bulambuli and the challenge is anesthesia, we deliver to you an anesthetist to do this scissor, so that we reduce on referrals into the hospital. We can only accept those that are beyond their management levels so that they can refer for us to handle. But our plan as LNMS and the national plan, with the help of the Commissioner, Dr. Mahagahi, and the PS, LNMS so far has done great wonders. We have lesser maternal deaths compared to what used to happen before, because we are preventing them from occurring from the sites where these mothers are coming. And this has improved the service delivery for mothers and their children. We have a group that has been formed, that the communication that is cutting across all stakeholders, from the leaderships of the districts, that is the COWs, the LC5s, the RDCs, the opinion leaders, the VHTs, and all the DHOs and the ADHOs are on that platform. So if there is an issue in an example, Mulanda Health Center, we inform the team in Mulanda and what do they need so that the service can be given. And usually they know of their leadership. So that's how we manage to get this, because it's a platform that has been formed. And this information flows across the whole Elgon region. Even if it is Kapchora, Sebe region, if it is the Bukedi sub-region, or it is Elgon, it is cutting across the whole region. Actually, we do lose because of, at times, those that self-refer after going to traditional bond setters. So these mothers will go to traditional bond setters and delay there and come when they have ruptured or they are about to rupture. So when they reach, at times, they reach at the verge of death. They always reach very late and they die because it happens. But those are manageable ones. If the traditional birth attendants can understand their knowledge of referral, then the death rates will have reduced significantly. But as of now, mothers who die, who come from the health centers, are significantly reduced, because we are empowering health centers by training the doctors, training the anesthetists, doing supervision of the health centers to better their capacity in managing mothers and their babies. You should know that Marathon Referral Hospital services are for each and everyone. And this is a hospital that is supposed to be owned by the community. It is your hospital because this hospital is there because of you. So you come for your services and receive your services. If there is any concern, please you come and inform the administrators. But the hospital is delegated to the community of this nation and the region to serve. So do not hesitate to come for services. There are those wrongdoers who are extorting money, which is true. There are those, but those are individuals. And then the other thing is the attitude. As a hospital director, I can teach you how to work, teach you how to operate, but I cannot teach you the attitude. So there are a few people that we deal with, but in place we have mechanisms that you have put to get these people put to question and explain why they are doing such things. But so far, we appreciate that they have reduced in number, and we appreciate the services that we are giving, that the community can give us feedbacks in regard to the services that you're offering to them.